So we're taking a multi-pronged approach to addressing the opioid epidemic. And that includes, as I said, effective treatment services, it includes prevention services, it includes overdose reversal products like naloxone, which we hope that you will learn to use and that you may at some point have an opportunity to save someone's life by using it.
Hi, my name is Bobby McCormick, and on June 1st, 2016, I overdosed on heroin. The first thing I remember being revived is waking up in the back of an ambulance and with two paramedics standing over me, and I asked them if they had just given me Narcan, and they said yes.
Hi, my name is Kathy Arbini, and I lost my son Kevin November 2009 to a heroin overdose. 2009 seems pretty long ago. It was 8 years ago. Education-wise, it was millenniums ago. But the loss of a child was just like yesterday.
I've had multiple friends who've overdosed. Some were lucky enough to have somebody there that called 911, and some weren't. I think with the prevalence of fentanyl, now is a really good time to have the education and have the means to have Narcan available at all times.
Opioid overdose is a reality. In Missouri, every day we are losing 3 individuals to opioid overdose deaths. There is a medication that can stop someone from dying, which is naloxone.
Naloxone can only do one thing, and that's save your life. And if you think they're overdosing, you use it. If they're not overdosing and you still use it, they're fine. You're not going to kill them by doing that. So it's something you should always have with you.
Of course, every pharmacy is going to have their own procedures. You should be able to walk into any pharmacy, give them your name, and tell them that you would like to receive an order of naloxone and be able to get that filled.
This is a medication that when given, it reverses the reverses the effect of opioid on the respiratory centers and helps the person breathe again. It is life-saving. It is available in all pharmacies, even without a prescription.
If this is your first time receiving an order of naloxone, you should go in, talk to your pharmacist. They may not be aware of the standing order. You can go to the Board of Pharmacy's website, you can look at it together, discuss how to best get it in your hands. You can bill it to your insurance if you'd like, you can just pay cash for it and leave the store that day with naloxone in your hands.
So how does the Narcan work? So those opiates enter the receptors in the brain. They signal to the lungs to slow down or stop, and those opiates are lodged in those receptors. When Narcan passes the blood-brain barrier, what happens is those receptors want Narcan more than anything that's in there right now. So it will kick out the heroin, the oxycodone, the fentanyl, and then the Narcan will take its place. Now the Narcan just sits in the receptors and doesn't do anything. However, we no longer have any heroin or opiates in those receptors. We no longer have a signal to the lungs to slow down, and the person typically resumes breathing within about 30 seconds to 2 minutes. You may need multiple doses of Narcan, and that's okay.
One of the elements that we want to incorporate in treatment is the use of naloxone, and we encourage every client who has a history of overdose or a history of opioid use disorder to avail themselves of the use of naloxone.
I've been around where several people using have went out. It was 8 people, I believe, they dropped dead, and it was nothing we could do for them. We tried everything, and Narcan was something we had never heard of, and we didn't want to call 911 because of the harassment, and I was a user and didn't want to be caught, with drugs on me. But Narcan would have been played a major role in their lives. I do know that they would be alive today.
Had Narcan been available to us as just users the way it is now, I think a lot more of my friends would have lived, and maybe they would have found recovery as well.
Naloxone can be used to reverse an opioid overdose of any form of opioid, whether it's injectable or prescription medications.
But I lost a lot of friends drinking and then doing heroin and dying, overdosing. And the funerals, they are heart-wrenching. I think the most heart-wrenching sound is the mothers wailing for their kids.
Naloxone is absolutely not enabling. Drug users are going to use drugs. That's a fact. Naloxone just enables possibly for them to live long enough that they can find recovery and have a good life.
Somebody who is afraid to administer Narcan, I would say it's not going to hurt anybody that isn't already overdosing. It's not something like an actual opioid that's going to make somebody overdose. It's only going to reverse an overdose.
So the three protocols we take when somebody overdoses is we call 911, we start rescue breathing, and we administer Narcan. All right, so we're going to demonstrate our two types of Narcan that are most used, which is the nasal and the IM injection. Okay, so for rescue breathing, it's very simple. You have to create an arch with the neck. You can do that by putting your hand on the forehead or by lifting the neck with your fingers. You have to create this arch or you could suffocate them. It doesn't have to be an extreme arch as this guy, but you just have to know that you're doing it. So you do that, you pinch the nose, and it's one breath every 7 seconds. That's rescue breathing, also known as BLS, basic life support. All right, and then for the naloxone, for the nasal, they're very easy to use. It's a little tester right here. So after I've done a good breath, I administer the Narcan in the nose, and I push the button, and that's it. The person does not have to be breathing in order for the Narcan to work. It does not process through the lungs. It actually processes through the membranes in the nose. And for the vial, the injection is going to go in a big muscle. So for most lay people, your most easy to access big muscles are going to be the leg, the butt, or the upper arm. Now the needles we give with intramuscular Narcan, these are not the same needles that people inject drugs with, so you don't have to really be worried about that. The gauge is much bigger. This will actually go through clothes. Okay, so sometimes people will have difficulties in the beginning with getting the all this liquid out of this little vial, but there's a little trick. So you get this vial, pop off the cap. Okay, so what you do is you're going to pull the plunger down all the way. Now you're going to, if you can see right, kind of, my needle is right, really just barely in there. I can see it, but it's right in the neck. I push this up and I let go, and the air pressure is going to draw that in all the way. So in about the amount of time it took me to get the nasal in there, I've actually just loaded the syringe. Air bubbles are not inherently dangerous. That's old wives' tale, but you do want to get them out because they will cause resistance. So you bring that up to the bottom, and if he had legs, I would go right in the leg, and then I would inject the liquid. So I've just administered Narcan either through IM or through nasal, then I resume my rescue breathing. One breath every 7 seconds.
So for those that are ignorant to the law, the Good Samaritan law is for those that don't feel comfortable calling 911 and being users. I know it's scary to call. You don't know what's going to happen after that. But they passed a law that says that you're covered and the person that has overdosed is covered, meaning that you won't be harassed. You don't have to run, you know, you're free to help save someone else's life, you know, and I encourage everyone that if you're around someone that's overdosed, do call the police, you know. Don't worry about what happens after that because the law stands behind you.
The wake-up call isn't always there the first time that somebody overdoses. You know, so it takes some people 5 times, some people 10 times to get the wake-up call, but I was lucky enough that it stuck with me, and that's a place I don't want to be again.
Had naloxone not been available, I wouldn't have found recovery, and I would not have the, you know, coming up on 2 years that I have, and you know, my life is drastically transformed in that period of time.
We have what we call harm reduction survival rules that everybody needs to follow. Those rules are very simple. A, do not use alone. Rule number 1, do not use alone. 2, always carry Narcan. 3, taste your shot. What that means in slang terms is you can do a little bit now, and then you can do more later. Purity is changing constantly, even from the same batch. One capsule, one bag could have a different concentration than another bag. Okay, and the 4th one is, since we're following rule 1 and we are not using alone, stagger your use by about half an hour between individuals. I know it sounds difficult because that rush to use is very powerful, but we've all seen the stories in the newspaper about 2 people died from apparent overdose, 2 bodies found. What happened? They didn't follow rule 4. They used it at the same time and they both overdosed at the same time and they couldn't save each other's life. If you're in a situation where you have to use alone, and it happens, there's other things we can do. First thing you can do is create a buddy system. You text somebody and say, I'm about to use, if I don't shoot you a text every 10 minutes for the next hour, call 911 to my location. Second one is use it in a public place, public bathroom, where the stalls have the bottom cut out, where if you fall down, somebody will find you. The last thing you ever want to do is lock yourself in a bathroom at some gas station who doesn't check the bathroom once every 12 hours. We are losing way too many people because they're not following those simple rules. So please, from here on out, we hope everybody finds recovery. However, if you decide to pick up again, follow these rules and you will survive long enough to get back into recovery.
Anybody who has used opioid use disorders will tell you that I've gone through every treatment you can think of. I had been in residential facilities for 30 days, 60 days. I got out and I used again. I've been in all sorts of treatments. So why is it different this time? The difference is that we have now identified that medications along with psychosocial treatments do improve the chance of decreased relapse and recovery. It is a new way of thinking about the treatment of opioid use disorder.
So what we hear frequently when folks are trying to get into treatment is, I've called, no one has an opening, I'm waiting, I get put on wait lists. Please be your own advocate. You need to advocate for yourself. Continue to call. Don't give up. Call every provider that is available to you. Eventually, you will see success.
And then on December 26th, I started outpatient treatment because even though I was serious, I really did want to get sober. At that point, I couldn't imagine myself not using the drugs because I knew, one, I was going to be sick, and I didn't want to be sick because it's just horrible. And I had been doing the drugs so long, and I was already 45 years old, that I didn't know, if, as old as I was at that point, if I was really even going to be able to stop.
She told me that, yeah, you just take it and you don't feel dope sick at all. And I'm like, yeah, right. It said, really? You take a pill and you don't feel dope sick. It takes all the sickness away. And unless you have been through withdrawals, you won't know what I'm talking about, but it is, you can't believe it. I did it.
So at the present time, we have 3 medications that have been approved by the FDA for treatment of opioid use disorders. So opioid use disorders means the body is needing opioids, either heroin or opioid pills, in order to function. The first medication is methadone. This has been available for a very, very long time. The second medication is buprenorphine. It's also known as Subutex or Suboxone. And the third medication is naltrexone, or otherwise known as Vivitrol, which could be available as a pill or could be a long-acting shot.
Methadone was like a perfect choice for me. It was, it worked. It was the it thing for me. It was a medicine that was monitored. It was taken every day. I actually was excited to get up and go take it, knowing that I had the opportunity to get it right, to start over. You know, that I was even still living, to take methadone to do better. It gave me opportunity. It helped me to become a better mother.
I got on Suboxone, and it's a sublingual, bilingual, and you have to let it, a sublingual tablet, you have to put it under your tongue and let it dissolve. And it does, they find the dose that you use so you don't get sick. And then you climb up, they adjust it. It takes about a week, but then you find where you're at, and that's where you stay at.
I just know that all treatment is not the same. I didn't know that most people, especially my son, he had a couple issues. And if you're just gonna treat the heroin addiction, you're failing on other things that was wrong with him, whether it be bipolar, whether it be depression. You have to find the treatment center that is right for you or your child. Just because it's, you know, the coolest place, California, to go doesn't mean it's going to do what you need it to do. You need to cross-reference, make sure what they say they need to do with your child is there.
So our goal with medications is to not only address those withdrawal symptoms and that uncomfortability that comes from withdrawal, but also then to quiet the cravings. Once we can quiet the cravings and that incessant voice saying, I need to use, I need to use, I need to use, we can start addressing through psychosocial therapy all of the other issues that come with the addiction. So at that point, a client would then meet with an individual counselor, start talking about individual issues, things that have maybe precipitated the use, but also things that we can put in place and supports that can be put in place to aid in ongoing recovery. So in addition to addressing both the substance use disorder, we would also be addressing any other issues that might be present. We can provide some family services, some family counseling, some couples counseling. We can provide some social supports through peer mentoring services.
The road to recovery is not easy. There are so many times it's an up and down road. It's not one straight road. Individuals typically state that it takes multiple years before they can reach the road of recovery. Medications are the first step. They stop with withdrawal and they cut down the craving, which often are the barriers in stopping patients from engaging in long-term treatment and reaching recovery.
I use the example of if you were a diabetic, would you be ashamed to be taking insulin? And I approach it from the standpoint, diabetes is your condition, insulin is the medication to manage that. You know, opioid dependency or drug dependency is your condition. We have medication to help you overcome that.
So this time around, I got on Suboxone September 30th of 2015, and this time, you know, I actually wanted to get off heroin, so I kind of approached it a little differently than any other time. I would, you know, before I would get on it and I would get taken off and go right back to what I was doing before, but this time, you know, I got on it, and when they started to try and get me to wean off of it or taper off, I refused, and kind of, you know, the doctor I had was a doctor I've dealt with for years, and, you know, he's seen my pattern, and he's seen that every time that I was taken off my medication that it ended in a relapse and back in treatment. So this time we decided to not come off of it, and yeah, that was about 2.5 years ago. So, you know, Suboxone was it played a crucial role in why I'm still here today, clean and sober.
So since I've been on the Suboxone the last couple of years, my life has changed immensely. I mean, I'm coming up on 5 years clean, and I did not think in 5 years my life would be as wonderful as it is.
Key thing is being an advocate for yourself, being advocate for your personal health, be an advocate while you're on the program, be an advocate before you get on the program, be persistent in this area. Communicate with the people that can help you. Nobody will know unless you speak up, you know. It's your responsibility to do so.
After asking around, because I knew that it was something better than this life, you know. I knew that it had to be some type of help. But I really had to dig, because if people weren't looking for help, they really didn't have the information for help, you know. I went to several hospitals and I gave them a story as if it was just a friend using, and they kind of gave me direction. They would tell me that it was a treatment center here, or, you know, you have the option to take this medicine or this medicine, whatever works for you. But I do feel as though had I known in maybe the first 2 months of me using, my journey wouldn't have been as long, you know, and had I known that people really do care, you know, they really, you know, they care that you're on the drug and that you want help, you know, they don't like downplay you or anything. But had I known that, yeah, things would have been a lot different.
There's a solution, you know, we do recover, and for me, it was through Suboxone coupled with 12-step recovery.
When you're not on drugs or anything, you start thinking, and you think normally. And again, I say it's with my religious beliefs. I'm trying to be, and, you know, walk like a Christian. That I want to do right now. I want to be law-abiding. I want to be a productive member of society. Okay, you could say that, but you want to be that. Suboxone helps because I have a clear mind, and my thought process now is not to get dope; it is to do right.
Today I have friends. Today I have people that actually call me because they care about me and want to talk to me. Today I'm a good employee. I'm trusted. You know, I have keys to things. I have keys to buildings. You know, I have money in the bank. I have a driver's license. I have insurance. You know, all these things. I don't have to steal for my next meal. I don't have to steal for my next fix so I'm not sick. You know, I get up and go to work every day.
My life today is completely different than it's ever been. All I've known since I was a teenager was, you know, the getting and doing drugs. That's all I knew. You know, today I have a career, you know, I work, I have a house, I have a vehicle, I have, you know, a relationship, and we have, you know, I have a child on the way. I mean, this life is something I would have never dreamt of.
Please join us in our efforts to improve people's lives, not just improve lives, but to save lives, and to help people get into meaningful and long-lasting recovery.